All right, Sandy, we're live.
Very good. Good afternoon, everyone. We are just in the process of letting everyone on board on the webinar today. Just a couple of things as we're getting set up. Today we'll actually have live closed captioning for the Q&A, live closed captioning available. And also the Q&A on the chat option. So we encourage everybody to be fully engaged as last Thursday as well. As we get started here, I'm Sandra Brown, the Vice Chancellor for Research, and this is our opportunity to talk about the situation for research here at UC San Diego. We're really pleased today to begin our town hall with a few comments by our Chancellor, who has taken time out from another meeting to join us for a few minutes. So Chancellor Khosla.
Thank you, Sandy, and good afternoon, everybody. And thank you for being on this webinar. Even though I cannot see you, I know I'm talking to all of you. I see this number 152 out here. So there's about 150 people on this webinar. I thought what I'd do is take a couple of minutes and tell you a little bit about what's been happening in the background. So if you've been watching the campus, I hope you would agree with me that the things on this campus have gone relatively smoothly and certainly way better than I was expecting. Now remember, overnight, we had to go from normal operation to a complete lockdown, to an emergency control center. And for the last 3 weeks or so, I've been meeting literally for an hour every day until last week. With something called the Emergency Operations Center team. It's about 45 people from every walk of life on campus, bringing their perspective on how to keep this campus operation going. And those conversations, and then the actions followed by, after those conversations, by each one of those people, is what is keeping this campus transition happening so smoothly. So the deans, the provosts, the department chairs, the administrative unit heads, everybody has pitched in and then some more. They have done their job and then some more to bring us to where we are. So the campus has been really fortunate. We've only had like 4 cases total, and right now we have no cases on campus. The hospital also has been relatively fortunate because, and Dr. Chip Schooley will talk more about it. At the end of the day, I think California, it was the foresight of Governor Newsom that took us to, that brought us to where we are right now. A relatively good position to be in. And on this campus, it was the collaborative work of all the people out here that has brought us to where we are right now. So as of right now, we have several work groups in operation. So for example, Dr. Sandy Brown is leading a work group on how to jumpstart the research. So we turn the switch off instantaneously. We cannot turn the switch on instantaneously. It's going to take some while. Indications are it might be as much as 2 years, it could be as few as 6 months, but nonetheless, it's not 3 days, it's a long amount, it's a large amount of time. So Sandy's leading how to get the research enterprise going. Elizabeth Brown's people, Elizabeth Simmons's people are leading efforts, and Dr. Chip Schooley is involved in this, on how to get the academic enterprise going. We have Patty Mason leading the effort on how to get the hospital going. So now we are looking forward to what is it that we should be doing in the next few weeks to bring this campus back into operation. At the same time, we're also evaluating the financial losses that we have incurred. We're looking at the budgets. We're looking at how are we going to make up for these financial losses and the revenue losses especially. All of this is a lot of work in progress, a lot of thought have been put into it, a lot of action. But the outcomes, it's going to take a couple of more weeks for us to have more definitive outcomes on some of these issues. I can go on and talk a lot about all of these issues, but I think we should be waiting to hear from Dr. Schooley and others. I'm happy to answer a few questions. I got to jump back to this other meeting for the Region's Health Services Committee. So, Sandy, and also let me just say congratulations to all of our faculty, because Sandy's been updating me And it's amazing in times of this crisis, our research efforts have nearly literally doubled up, and we have more proposals funded in the last couple of weeks. We have like great work
Hello.
on campus, and it's really good to see all the commitment that everybody's making to COVID-19, both in the medical school and outside the medical school, across the board.
Hello.
Wonderful,
Can you hear me?
Pradeep. Thank you.
Yeah,
You know,
David,
this time last year, or this now, we have 500 more proposals submitted this year than this time we had last year. And over 100 COVID-related proposals have gone in just since mid-February. So it's really remarkable how much work our faculty are doing and trying to help with this process. We're really excited and pleased about that. So if we have any questions for the Chancellor, he'll be able to be on for just a few more minutes. So please get those questions on chat. And while we're doing that, maybe we'll move on to David Brenner, whom I see up here in the corner. David, if you want to say a few words as we launch this research town hall. And David, we're ready for you whenever you're ready.
Oh, there you go.
Yeah, so we're ready for you, David.
do Alt Y if you want to talk. Alt Y will get you to unmute.
He is unmuted.
Okay,
Can
Well,
you hear me?
Yeah.
now we can. Yes,
I
excellent.
don't
Thank you,
have
David.
any.
Okay,
I don't think he can hear us, so
Sandy, put your finger up if you can hear me. I can't hear anyone. You
Yep.
can hear me? Okay, thank you. Okay, I'm going to give a little bit introduction. I don't know why I no longer have any speaker working. But anyway, I want to just review a few things. I first of all want to start by thanking Pradeep and Sandy because I think that their leadership was incredibly helpful in the in how we conduct research, and that many of our peer institutions have decided not to just to close their research portfolio, just to stop completely. And I think the way we're doing it is much more sensible. It's much less damaging. It's much better for the for the faculty, for the students, for the postdocs, for everyone whose career depends on this, and for continuing to advance science. And my only word of caution is that we should not abuse it, that we have to be very careful that we're practicing social distancing in the laboratories, that we're very careful about how we use animal facilities, that there's not more than one person in there, that there's not more than one person at a bench, and that we do, when we need to be in the laboratory and do research, we do it, and then we leave and go home and analyze our data at home. And if we do that, I think we can be so much more effective than our colleagues who have completely closed down, who've just shut down their research. But the ball's in our court to behave. So I think it's really important. And thank you, Pradeep and Sandy, for making that possible. The second point I wanted to make was about recruiting. The default from now on is that we are recruiting, we've stopped recruiting. If we are going to recruit someone, it has to be approved at the level of the dean and the respective vice chancellor and eventually Pradeep. So assume no one's being recruited, start with a clean piece of paper, and then make your case for each individual recruit to go forward. And we will try to be as sensible as we can within these restricted times, financially stressful times, to do the best we can fulfill the missions of the university. The third point I want to make is that this is an incredible opportunity to use your fund of knowledge and your skill set to apply it to COVID-19 research. That there is resources available, there's extramural support available. We have many techniques, everything ranging from public health research to high throughput screening, to novel assays, to a whole variety of approaches to apply to COVID-19. And if we do that, I think not only can we continue our research portfolio and expand it, but we also can make a serious contribution to society. And it really shows the strengths of academic research universities that we can that we are able to take our incredible skill sets and apply it to a new field. And the fourth point I want to make, and Pradeep had raised this with the regents earlier today, is that we have an opportunity to use public health research to look at whole populations at both the incidence and prevalence of the COVID-19 infection and also the antibody response. This is not clinical care, this is research, but we can use our expertise and our platform technologies to actually approach whole areas of this campus. And the long-term goal, which I think is achievable, is to make this campus as safe as possible, that we can understand the entire COVID-19 effect on this campus like a small city. And then from that, from understanding what the snapshot is, to then go on and to then make rational decisions about what to do clinically. But I think this is really an opportunity to show our stuff and show how we can be useful to the community in a way that really is quite unprecedented. So I'm going to stop here. I'm going to turn it over to Chip because I have not figured out how to get my my sound to work. But hopefully at some point when someone has questions, I will be smarter technically. But in the meantime, I would like to turn it over to Chip.
So before we do that, David, I'm going to just share one question for the Chancellor that did come in. And it was a question about the kinds of activities that university presidents or chancellors are taking to increase federal and state funding to compensate for research losses during this period of time. If you could just share with people a little bit about the kinds of things you've been engaged with there, Pradeep, because I know you have been.
So the one-word answer would be lobbying. A more polite word would be advocating for our interests. And this is where Angela Diaz is on this line out here, representing us in Washington, D.C., has been very foresightful and aggressive about this. So literally last week, we were on a video conference with all the congressional delegation from San Diego, talking about the needs and the impacts on UC San Diego. We've done the same with Sacramento, Caitlin Schell, working for Jeff Gaddis, and Buckley is the one responsible for representing us there. And then we're also doing the same exact activity to Office of the President, which also has a Sacramento facing office and a Washington facing office. So there's a whole lot of stuff going on. And that's why you're seeing these care packages, I call them care packages, the CARES funding. It doesn't have everything we need, but they are beginning to listen to us. And we are hoping that there would be some sort of an RR type of funding in the infrastructure side, where we could be using money to fund infrastructure and then using our operations dollars to fund other activities that would have funded infrastructure in the past. So there's a lot of work going on, and we are seeing this in this quote unquote stimulus bill, but it's not as big on the education side as it should be right now.
So maybe the next stimulus support funding will be, and I know we're going to get to Angela who will share some of the details of that. Yeah.
So they call it like 3B and 4, in the stimulus 3B and stimulus 4, but I think there's going to be more education funded work money in there.
Okay. Excellent. And thank you so much, Chancellor, for all the effort that you put out in this area to support the researchers on our campus. I think recently we calculated the number of folks that are paid on grants, that contracts and grants that include faculty, students, and staff. And we've got about 10,000 people that are paid via this extramural process. It's a really important component of what we do here and a core part of who we are. So thank you so much.
Absolutely, and also it's an important component of our reputation and how we are perceived by the outside. So look, I have to run, but let me just say thank you to everybody. I really, really, really appreciate your hard work. Times like this are very, very stressful. And during these times, it's easy for rumors to start flying based on not even an iota of truth in it. So all I would, David admonished you as saying, don't abuse it. I would say, don't believe everything you hear. I will be in constant communication. We have a website where we're putting out everything. Anything you hear about budgets, anything you hear about revenue losses, our strategies to mitigate where we are, our strategies to come back into operation and financially sound and sustainable. Just be looking out for memos rather than hearsay stories from your colleagues over drinks. So thank you very much. Do have a good time, and I'll see you around soon. Bye.
Okay, thank you, Pradeep. We're going to hear a little welcome from Vice Chancellor Margaret Leinan next, and then we'll get an update from Dr. Schooley. So, Margaret?
Great. Thank you, Sandy. And I want to add my thanks to those of the Chancellor and David for all the work that the Office of Research Affairs is doing and that you have led during this time. It's been the impact on research has been profound in the way that we do it. And you have really helped everybody with so many issues around the conduct of research and your whole team. Thank you so much. And David also talked, thanking the researchers and the students themselves who work in the lab. I want to add my thanks to all the staff who work on research affairs, whether it's in ORA or in all of our units. I have been hearing how difficult it is to do this remotely when you're counting on, when you've been part of an office where there are, 3, 4, 10 people, all of whom work together on getting things done. And you have to, the transactional cost and the time cost of supporting this whole effort has become extreme. And we really appreciate everything that you're doing in the business offices, contracts and grants offices, all of the personnel that work for our researchers to make this happen. It's really important, and you've done a magnificent job. Thanks so much.
Thank you, Margaret. Appreciate that, and appreciate your thoughtful perspective on this, and Vice Chancellor Brenner as well. We have the good fortune of having Dr. Chip Schooley with us, who's going to give us an update on what our current situation is here at UCSD and in San Diego. So Chip, I'll let you take it over.
Thanks very much, Dr. Brown. I'll just be briefly running through the data as they are as of last night. And what you can see is that starting from the big picture, globally, we're about to pass the 2 million reported case threshold, remembering, of course, that these are only reported cases that have been tested. So the number of people in the world with this illness is much greater than that. And the number of people with infections even greater than that. Nationally, we're at about 600,000 cases, and about a third of these remain in New York. But New York is beginning to quiet down, and we're beginning to see a shift, as I'll show you in a minute, to the southeast and to the Midwest. California accounts for about 25,000 cases. We've begun to drop in the ratings, which is great. We were number 4 when we had this call a couple of weeks ago. This is a good one to be a lagger in. And as I'll show you in a minute, our curve is much flatter, which is why we're dropping, particularly on a per capita basis. San Diego has been reasonably spared so far. We are at about 2,000 reported cases. We've had, unfortunately, 53 deaths. And we now have 164 people in the county in intensive care as we speak. And many of these people are unfortunately going to not do well. So we will continue to see the deaths occur over the course of the next several weeks, even if the number of new cases, as I'll show you in a minute, continues to decline. In our own hospital, since we had a call a couple of weeks ago, the rise has been about a 10 patient net increase. And again, this reflects the carryover from people infected several weeks ago, as opposed to what's happening out there now. And we think, based on both the data that are coming in, the counts, and by some very elegant modeling by Natasha Martin, that we are near our peak in terms of the healthcare system's um, impact on the epidemic impact on the health system, provided we continue to be attentive to social distancing, because all of this can start back up again if we start too soon and start too recklessly as we see the curve passing behind us. And one more slide, if you will. This is a very nice compilation that I recommend to many of you if you're trying to get an idea about what's going on nationally. And you can see that these are curves that are based on the number of reported cases as a percent of population. So it corrects for the size of the state. And the good news is you can see California is really quite low here in the overall scheme of things. New York obviously is way at the top and remains there. And is above the threshold that one would expect for ICU bed utilization, which is why they've been so pressed. The best news for us, however, is if you look at this curve, you can see we're progressively flattening, and we are now down in this group of states in the bottom between 37 and 43 that are only seeing a 5% per day rate. And to put this into growth rate, and to put this into perspective, a couple of weeks ago, we were talking about 20% per day growth rates. Within 3 days after that, it dropped to 19%. And again, looking at the data today, we're down to about 5%, which is really a great testament to all the things that all Californians, and particularly people here at UC San Diego, have been doing. So that's the 35,000 foot summary, and I'll stop there and pass it back to Dr. Brown.
Thank you, Dr. Schooley. And there may be questions about this. We're going to run through a little bit of additional information and then open it up for everybody to ask questions. So I hope you'll be able to be with us. The Chancellor referred to the research continuity plans that we have and the task force. And just to remind people that our guiding principle is to protect and maintain the health of our community, all of its members, while allowing for as much research as possible and being creative in the way that we do that. So as Dr. Brenner said, we've reduced the types and numbers of people that can be in our research laboratories and our research programs, always staying in compliance with the CDC guidelines and recommendations from the state and locally as well. In regards to that, we want to keep our staffing personnel in our labs at a minimum. That's at any given time. So if you're rotating, if you have a morning rotation, an afternoon rotation, an evening rotation, it's not the overall number of people in your research program that can be in the laboratory. It's how many can be in at any given time. So if you can think of ways to structure your activities so you can have, we can begin to scale up using that same framework, the same controls, safety controls. That's another way to think about our actions. We have a large planning committee that is looking at processes and plans to help us even further scale up as quickly as possible as soon as we hear it's safe to begin that process. As Chip was outlining the information about rates of growth. We want to keep our plans in full alignment with the university in relationship what students are allowed to do, staff and faculty are allowed to do. And we do know that there are different kinds of risks in different types of research settings. And so there may be some areas that we'll be able to scale up faster. There are some areas where already we're able to do much more because we can do more remotely or through virtual assessments. But our goal is to move forward as quickly as we can. If the research risk changes, if the risk to our staff changes, we may have to scale back a little bit. Then as soon as we're in the right framework, we'll scale up again. And our goal is to be able to fully get our research enterprise back on track as quickly as we can. We've got faculty, academic senate members, people from animal research, clinical trials, other types of human research, all engaged in this process of planning. And many of you may have heard the governor yesterday outlining indicators that allow us to make changes in his stay-at-home order. And we're going to be using those as general guidelines here on our campus as we move forward. And I do want to point out a couple of things that universities are going to be key to this process, both through the development of therapeutics, either treatment of those that are diagnosed or via vaccinations, to participate in the overall social distancing plans, but to help educate, guide through new information that we're gathering, ways that we can further get our economy back on track and all aspects of our life back on track. So in the next, we're going to hear from Kip Cantello with a couple of quick updates about human subjects research. And I just want to say in advance, we appreciate the new flexibility that Kip has created through the IRB process. So Kip, I'll turn it over to you.
Thanks, Dr. Brown. This really reiterates what Dr. Brenner was talking about, that the institution as a whole has required reduction in face-to-face activity and really required remote or virtual activity to continue research, especially human subjects research. With a couple of notable exceptions for COVID-19 research, obviously, that we want that to continue in person where possible, and clinical trials of drugs and devices with therapeutic intent. Even in those two exception cases, you still want to reduce face-to-face activity as much as possible, continue treatment and safety monitoring per protocol, and really only do new enrollment when the trial is for a serious or life-threatening disease. And so as the situation is reevaluated, these restrictions may change. One clarification I want to make is that these are not IRB restrictions. We've gotten a lot of questions in the IRB office about whether someone's eligible for an exception or not, and the IRB reviews protocols but isn't administering these restrictions on research activity. So as Dr. Brenner mentioned, you would need to work through that process and escalate to your dean and so on. Hand in hand with these institutional requirements, we have IRB guidance that is posted on our website. We have, as Dr. Brown alluded to, some flexibility so that there's only a limited need to amend your protocols or to report deviations that are necessary because of COVID-19, really focusing on situations where you are adding COVID-related aims to your research. So that's not necessarily something you're doing for safety purposes, but you're expanding the aims of your research. Or if deviations really affect safety. So if you're missing drug dosing or things like that as a result of going to remote activity, that may affect subject safety. So those are the types of things that would need to be reported. Coming up soon, we have guidance on remote consent to facilitate enrollment of new subjects, especially in non-clinical research. And also we're introducing a new form that simplifies the process for secondary use of specimens and data to hopefully get some of these minimal risk protocols moving through much more quickly. And that's very helpful with COVID. Finally, I just wanted to highlight some central resources that are available. And these first two in particular are designed to avoid researchers tripping over each other and tripping over those providing clinical care. We have a central repository that is available for samples that have been collected from COVID patients, or also able to accept specimens collected from COVID patients. So this can be a shared resource for researchers. Also, some of our central data repositories have been adding COVID-related data points to their repositories so that if you just need a de-identified data set and you don't need to actually go trolling through the records yourselves, you can tap into those. I have contacts listed with email addresses for each of those. And then finally, for those of you working on devices, diagnostics, things like that, and need assistance with navigating the FDA emergency use authorization process, Hillary Calais in the UC Office of General Counsel up in Oakland is well versed in this and has been helping multiple campuses with navigating this, and her email address is there as well.
Great. Thanks for the update, Kip. We really appreciate that. We're going to be moving on to just a little bit of information about the animal care program and how we're operating now really to increase support for projects and programs that involve animal research. So Phil, would you mind speaking to this, please?
Thank you, Sandy. I can make this quick. The continued good news is that all our animal housing locations are remaining fully operational. Our animal populations are stable. So all that's pretty close to standard. The animal care program is providing full husbandry and research support and after hours emergency responses. So that's all going well and stable. There's not been a problem there. We've added measures for social distancing, et cetera. Research laboratory personnel, everybody continues to access the animal facilities as needed. That access has decreased considerably. So that is way down. We hear about pockets here and there, and I think it's incumbent on everybody to try to limit the number of people in rooms. We're working out systems to do that, but it's gone very well. So thank you very much, everybody. We have our standard operating procedures are meant to keep things like this from spreading in the first place. Those are all in place, but we've also increased the frequency of decontamination and changed some of our operating procedures just so we would decrease the potential of any SARS-CoV-2 transfer that could possibly happen. Actually, so here's the point. We have picked up and been taking a lot of additional efforts on the ACP staff where possible, helping with investigations. So that's something that's gone on quite a bit over the last 3 weeks or so. So that's something to be considered. And then finally, I just wanted to say that the facilities for being able to handle COVID-19, SARS-CoV-2 infected animals are being discussed right now. So those are hopefully around the corner. And
Great.
That's it. Thanks, Sandy.
Oh, thank you very much, Phil. And I'd just like to highlight two things. That our animal care program has worked very hard to sustain the animals that are available for research and our animal colonies. This is in contrast to some other approaches where those colonies have been dramatically reduced. And we've worked really hard to sustain these for you so that you'll be able to roll back into your research as quickly as possible, and it won't mean months or years of delay. And the second thing is that Phil and his team have picked up some of the care responsibilities for the animals that have been difficult for the faculty, and they'll continue to do that. Good. So that's about human subjects, about our animal research, and of course, the support for our staff. So we're going to take just a couple of minutes. I know last time we met, there were a number of questions about the hiring and sustaining staff. And I'd like to just remind people that folks that are paid on research funds can be temporarily assigned to other types of activities. Anything that is related and of value to your research program can be done during this period of time. Secondly, staff can be considered for HR's temporary work opportunity clearinghouse. And we're going to hear from Nancy Resnick in a few minutes about that. So if your grant expires before the end of June 30th, please remember that the terms that apply to management are those on which the contracts and grants were originally established. And there are some supplemental funding from agencies to be able to help recover some of the COVID-related costs. So next, I'd like to turn this over to Nancy Resnick, who will just give us an overview or an outline of what we have available in terms of administrative leave. Nancy?
Thank you very much, Sandy. And it's a pleasure to be with all of you this afternoon. So thank you very much for having us. I'm also joined by Terry Winbush, who's my Senior Director of Employee Relations and Labor Relations. But what I wanted to say briefly is first, we recognize that this is a time where we are very eager for information about how to support staff, what provisions exist to support staff. And there's information that's shown here on the screen. It's also available on the HR landing page, and I would encourage all of you to take a look at it. It's quite complicated. If I can just provide kind of a brief overview, one thing that is helpful to consider is that we've received a series of essentially directives and guidance on this from system-wide from Office of the President. So you'll recall initially we learned about the 128 hours of paid administrative leave that was issued by the President on March 16th. Subsequently, federal legislation was enacted expanding existing family medical leave provisions, an act that's called the Family First Coronavirus Response Act. And that has two components, which you see on the screen in front of you. Then we've had lots of discussion back and forth with OP in looking at very precise questions around, for example, what categories of employees are covered by what types of provisions? Under what circumstances do these types of leaves apply or not apply to differently situated employee groups? And we've then received some additional guidance about this, but I'll also mention another important event kind of in the series of information that relates to the workplace and specifically to staff in the workplace is that on April 12th, the President and Chancellors issued what I could refer to as the job protection letter, indicating that there would be no COVID-19 layoffs for career employees through the fiscal year, so through June 30th, 2020. So there's an interplay between all of these things, and there is considerable complexity to all of these things. I just wanted to say that we in Human Resources are here to assist all of you. We met earlier today with the group that we call the HR Council to share some more specific guidance on this. There are some particular aspects of these policies where there is actually guidance yet to be forthcoming from the Office of the President, so we're actively monitoring that information. We really want our landing page to be a source of updated, correct, comprehensive information, so I would encourage you all to please utilize that as a resource. And I think, you know, I would just say, you know, in more broad terms around just workplace issues, we recognize that this is a very challenging time. It's a time when, as we heard earlier on this town hall meeting, we've had just remarkable and amazing, you know, triumphs in our workplace, and that's a testament to all of you and to all of our employees. And at the same time, this is a situation that's very challenging for people. People are working remotely with little opportunity to plan for that, coping with family situations, coping with lots of challenges. So I think it's a time when we recognize that, and as Human Resources, we're really here to support you and your employees in any way that we can. And I did want to mention also that for academics, there's resources and special guidance that would be really available through academic personnel. So we have, overall across our institution, lots of resources and assistance. This this page that's up on front of the screen is hard to navigate through, and we recognize there will be individual questions, and we're happy to assist in those. And I think that's probably all you want to hear from me at this time, Sandy, is that right?
That's great. I think there may be questions. So if you'll just hang on in the town hall, but we'd like to get through a little bit more information and then open it up for questions. In very simplified terms, in the next slide, you'll see that there are some key things to think about if you're actually doing research hires, that is for new grants that you're obtaining, that those grants are going to be subject to standard kinds of reviews to make sure that there are enough funds for what you're proposing, and that any exceptions need to go through the department chair, who of course will discuss with her or his dean and ultimately the vice chancellor. Finally, I would also say that for postdoctoral scholars, the standard reviews need to occur through the Office of Postdoctoral and Research Scholar Affairs. So we're there to help you with that, to move through very quickly. And with any new people that we're bringing into our research context, if they're going to be on site at all, then your research site plans need to be updated. And remember, those need to be presented to the chair and the dean for approval. So as anyone is hired, we're going to be checking with the chairs just to make sure that those plans have been updated. So just mention that. Next is the really good news part, which is there's new flexibility in terms of a variety of things that are listed here: submissions, no cost extensions, when we need and don't need prior approval, for example. There are some new rules and new flexibility in all of these areas as advocated by OMB, and are now flowing through the federal agencies. Some of the details of these are on our central website to be a resource for you. You can see some of the specific information here, and all of our slides are going to be available to anyone on not only this webinar, but to the faculty and staff in general. Actually, I think it'd be good for us next to take a look at what we might expect at a federal level, because that's 2/3 of our research funding. So Angela Phillips-Diaz is going to be, this is just to remind you to track all your COVID-19 expenses, because you can be reimbursed for some of these through in some cases we can be reimbursed through FEMA, in other through agency supplements, but we're really going to try to help you easily identify those. And there are some keywords that are available on Kuali. If you just lock those in, then that will help us as you're going to be applying for those supplements. So next we're going to hear from Angela Phillips-Diaz about what we might expect federally. Angela, if you could say a few words about this.
Absolutely. Thank you, Sandy, and greetings from Washington, D.C. to everyone. We wanted to just remind people, I'm sure a number of you have read or seen references to the actions that the Congress and the administration have taken over basically the first 3 weeks in March. And so starting with the initial legislation and appropriations with what we're calling phase 1 in terms of the Coronavirus Preparedness Act, which included $3+ billion, again, focused primarily on vaccine therapeutics and diagnostics tied to COVID-19. And that includes $826 million to NIH specifically. They then went into, and Judy Resnick made reference to the Families First Act in mid-March. Again, looking at more the policy-focused items, so coronavirus testing, paid leave, and enhanced unemployment insurance. The big ticket item in terms of a supplemental occurred on the 27th of March, which was referenced as the CARES Act, which had significant research funding for agencies such as NSF, NIH, Department of Energy, NIST, EPA. And then we are in the process of seeing those elements, including for our hospitals and other parts of our economy, starting to receive those funds through various mechanisms. Well, I guess it was earlier this week, the Senate and the House were trying, if you could just go back 1 minute, we're trying to come to agreement on what we've been titling phase 3.5 in terms of funding. On the Republican side, they were focused on small businesses, which was looking at about a $250 billion appropriations bill. On the Democratic side, they are proposing additions, in addition to that small business activity, more funding for our hospitals, for universities, for research, and also for state and local governments. They did not reach an agreement before they adjourned. It looks like the Congress will not return to DC before May 4th. That does not mean that work is not happening. They're both the members themselves as well as their staff are actively engaged and committed to developing what I'll call this near-term phase 3.5 bill, because they recognize they're hearing the messages of how all of these communities, particularly in higher education and our health sciences, are being impacted by this pandemic. So we expect that they will have something when they return in early May. And then we're also confident that there will be, whether it's called phase 4, phase 5, additional supplemental legislation in terms of funding, recognizing that as we're going through this and as the length of time is better understood in terms of the impact, that additional resources will need to be provided. So we continue to work with them. We can go to the next one. The next slide, please. And so there are activities relative to these upcoming supplementals that we are looking at. There have been a number of letters from professional associations that UC San Diego and UC are members of, like AAU, APLU, AAMC, ACE, that have clearly articulated priorities for these next supplementals. Likewise, the University of California president has sent to the Congress our system priorities. And as the chancellor referenced, when we met with our local delegation House members, we provided our specific UC San Diego priorities, which were well received, and they are very supportive of advocating on our behalf. As Sandy mentioned, we continue in terms of our engagement with leadership in the Office of Science and Technology Policy, with different agencies, and with the Hill to encourage them to adopt policies and procedures that minimize or reduce the burden, the administrative burden, and so that we can spend the resources on doing the science and supporting our students and faculty. And then last but not least, the timely disbursement of the federal funds again, it ties to minimizing the administrative burden and getting the resources where the need is. We have a very strong team at UC San Diego in terms of the leadership that are fully engaged throughout, and I'm grateful in terms of the advocacy and with our members for people to contribute to that. Our members, they are fully behind us. They are actively reaching out to us to make sure we have what we need and understand what the challenges are. And then I think the other message I would ask people to keep in mind, we need to hear your stories, because we are trying to provide, whether it's the agencies or members of Congress, with tangible stories of what the impact is, both the positive and the challenges, because that sticks with people and it makes it very real. So my ask of you is to please work with your respective communications people, reach out to me or any of us, because that also helps us. And I think, Sandy, with that, I turn it back to you.
Fantastic. Angela is an amazing advocate for UC San Diego. She has an open door policy. So get your ideas, your thoughts, your needs, requests to her. And to really understand some of the COVID-19 or SARS-CoV-2 information that we have here at UC San Diego that might be a resource for you. We've set up this framework on the Blink website for research. One is a listing of the investigators that we have who have been or are currently involved in COVID-19 related activities. A second is actually the funded projects that we currently or have had previously, so you can see the kind of work that people have been doing. The third is, what are the funding opportunities? And these things are updated on a weekly basis. And then the fourth thing that we have that I think is really special about the researchers here at UC San Diego are these homegrown networks that we have that are just remarkable in connecting researchers with the research that's being done. So on the next slide, you'll see that we have something called Respond that's on Earth 2.0 or Co-Respond. And Linda Hill's gonna take a minute or two and share with us a little bit about what this network is all about. Linda?
Oh, thanks so much. First, Sandy, I just want to thank you in the Office of Research Affairs for your exemplary leadership. It's just been amazing. Our project, the Co-Respond arm of Earth 2, engages those needing help with people willing to help, and helps in the form of information, assistance, or materials that can be obtained by emailing covid-help@ucsd.edu. Solutions are crowdsourced, including our idle medical students who are amazing, and provided to the questioner in the form of help such as IRB support, material assistance, or written solutions, which are posted at our website. We're working with clinicians and researchers, our public health communities, and our global partners, including those in under-resourced settings, and to promote information for our global partners. Relevant solutions are now being translated. Additional resources provided by Earth 2 includes a symptom tracker for clinical trials that interfaces with REDCap, and then 2 apps that are being rolled out for supporting COVID efforts, OASIS and Homebound, addressing home monitoring, contact tracing, and physician-patient communication.
This amazing resource, Linda. Thank you so much for your leadership in bringing this to fruition and bringing our researchers and clinicians together to create this kind of network. We have a second homegrown network also, San Diego COVID Research Enterprise Network, or SCREEN. And I think we have Rob Knight on the phone who can talk with us a little bit about this. It's not exclusive to UC San Diego, but really is broader than that. It's for the San Diego community. Rob, could you say a few words about this?
Yeah, thanks, Sandy. And like Linda, I'd like to thank you and ORA for all of your efforts to help coordinate research and get to UCSD. So what Screen is it's a cross San Diego effort to put together the different things that are needed for the COVID-19 response. And most recently, we opened up a research project with drive-through nasal swab screening. So that's been active since Monday. And right now you have to be a healthcare worker or at least in the School of Medicine at UCSD to participate. But that's already up and running multi-institutional. And that involved a lot of components, everything from IRB to 3D printing swabs, which were in short supply, to getting all the logistical pieces worked out. So Screen has a Slack set up. Anyone can join. We have over 700 people on it already, and we're continuing to expand rapidly. There's a lot of topics of discussion, everything from new research ideas to the mechanics of making a research infrastructure that will help get things opened up again and provide the kinds of epidemiological studies that we need to understand how SARS-CoV-2 is spreading and what we need to do to reduce the risk of COVID-19 on campus.
Fantastic. Thank you, Rob. I do want to say that both of these networks have been instrumental in the over 100 COVID-related proposals that we've submitted here on campus just this year so far in these first few months, actually primarily in the last 2 months. And in securing several major grants already. So this has been a tremendous resource for us. Rather than talk about any individual opportunities, because these are all available on our website, I just want to make a point here about the federal and private related opportunities. That while they started primarily in terms of medications, treatments, and vaccine focused, they really now are very broad in terms of the content areas that are being integrated. So it's hard to think that there's a part of campus, whether we're talking about political science or economics or social and behavioral studies or molecular biology, that doesn't have an opportunity that's COVID related for them. So I just refer you to the website. Miroslav is going to take a moment to talk about some current state level opportunities that we have that are primarily, we're going to talk just about things that are in the UC system. And then immediately following that, we'll get to your questions. So Miroslav.
All right, thank you all for joining us, and thank you very much, Sandy, and everybody else. So I'll say a few words about 3 opportunities that are local to the UC system or to the campus. The first one is the largest of the 3. And it's a program for allocating $2 million through the UCOP, for which our researchers have already submitted many proposals. So a total of 63 proposals have already gone out from UCSD for these sort of small to mid-sized $25,000 grants. A piece of very good news fresh off the press from UCOP is that of the $2 million available, 500,000 have already been allocated, although I don't think that the PIs have received the news yet. And the good piece of these news about the 500,000 is that the UCSD researchers are receiving 125,000. In other words, a quarter of the UC system allocation so far in this rolling deadline program has gone to UCSD researchers. Now, 125,000 is only 5 grants. So if you thought that it was easy money, you know, it's 5 grants for over 6 proposals that our researchers have submitted. How are they evaluated? Just in case you've already submitted, you're planning to submit. This is being evaluated administratively, but the evaluators are not lay people, purely administrative people. The evaluators are the directors of 3 California centers. One center for tobacco-related diseases, another one for breast cancer, and the third one for AIDS. So these people are MDs or PhDs, and they're looking at these applications. And in case you haven't submitted yet, but you're planning to submit, keep in mind that their perspective is strongly colored by the fact that the funds come from their programs, and that their primary interests are the connections between COVID-19 and tobacco, breast cancer, and AIDS, as well as more broadly. The PIs who have been selected are probably going to hear within a few days, and this competition will continue. The next sort of round of announcements, the first one being in mid to late April, the second one will come in early to mid-May. The announcements about those who have been selected. Since I'm just pasting into the chat the link to that program, as well as the link to the second program here on this slide, which is a campus program funded from a block grant that the Vice Chancellor for Research has received from UCOP, $50,000 to be distributed through $5,000 grants, with a very, very simple application process for such a modest amount of money, $5,000 per grant. But the deadline is tomorrow, so I encourage you to consider submitting to that. The abstracts are limited to, as I recall, 250 words. So if you do have ideas, please submit. The topics that are considered the priority are these 6 topics listed on the slides, and they're defined by the Department of Energy because the funds for these block grants come from the national lab management fees that the UC receives from the Department of Energy. And third, there is going to be very soon another internal grant opportunity, an Institute for Engineering and Medicine GEM program, Galvanizing Engineering in Medicine, will distribute a total of 60,000 in grant sizes that may be not smaller than 15,000. So maybe 4 grants of 15,000 or something that is possibly more strategic than grants of that size. And the funds come from Shu Chen, the former director of IEM, has donated 30,000, and IEM has matched that with another 30,000 that come from the contribution to IEM from the Dean of Engineering, Al Pisani.
Excellent. Thank you, Miroslav. So we wanted to highlight these because they are small seed type grants that can help individuals who heretofore have not been engaged in COVID-19 related research, or where there is something that could be done by way of a pilot that would position you better for one of the upcoming larger opportunities. So encourage everybody to take advantage of that. So now we just want to throw this open for any questions from participating in the webinar today. I know there have been some questions that have been posed as we've been going along, and people have answered or addressed those, but really now is the time to ask your questions. And we're fortunate in that we have a number of people with a whole variety of different kinds of expertise
Should research staff who are unable to engage in on-site research use their vacation or sick leave after their UC mandated 128 hours of paid administrative leave has been used?
So I'll take this question. So the first question I have is the research staff that we are talking about, are they academic personnel or are they staff? And then if they are staff, are they represented by a bargaining unit or not? Depending on those answers will depend on how we answer that question. Generally speaking, if they're unable to, if there is not work for them to perform either on-site or remotely, and they don't otherwise qualify for the federal leave, the emergency paid sick leave, or the emergency family medical leave, and they've exhausted their paid administrative leave, if they are career staff, then they will have pay continuation through June 30th. But I still would need to know those specific questions that I initially asked to fully answer that question confidently.
So, and Terry, maybe you or Nancy could comment on, from a faculty member or researcher's perspective, if they have staff that are in this situation. Can you just talk a little bit about the sequence of considerations for these various types of leave that they might want to take advantage of?
So it really comes down to what their particular circumstances are. If they have eligibility criteria under all three, they can choose which order they take it. The most flexibly used leave is the university's paid administrative leave. That can be used, and I know that the website from OP says it has to be 1 day increments, but the way that we have implemented that locally is to allow for smaller increments so that people still can engage in some work if there is some work available for them. As it relates to the emergency paid sick leave and the emergency family medical leave, those have to be taken in blocks. And so that makes it much more difficult for an employee who does have some leave or some work that could be done to really still be engaged with their work for a significant amount of time.
Excellent. Thank you so much. Thank you. Nancy, anything you want to add to that?
Yeah, I did want to go back to the clearinghouse, the temporary work opportunity clearinghouse as well. And that is a resource that we would encourage you all to look at if you have either a situation where you have staff who have bandwidth for reasons that would relate to kind of the changing context in which we find ourselves, or conversely, if you have so much work to do and you really need help. So we've set up a clearinghouse that's managed through Human Resources, and it provides an opportunity for a manager to essentially sign up for a service where we will attempt to match areas where help is available with areas where help is needed. We will have an interface through the temporary employee services staff who are essentially deploying to help facilitate this process, to have a conversation, learn more about the skill set and the the skill set of the employees, or conversely the needs of that unit for skills, and we will attempt to match that up. That's predicated on a desire to do the work. So I want to be clear, it's not a it is not an involuntary process. It's predicated on kind of goodwill and wanting to help out colleagues in this situation. And we've had quite a bit of interest since we launched the clearinghouse. It was only probably less than a week ago. So I'd encourage you to look at that as a resource as well.
Such an amazing opportunity, people coming together to ensure that to the extent that's possible, we exhaust all these resources so that we can maintain continuity of positions for people. So it's a wonderful resource. We appreciate you having stood that up. Good. Do we have another question?
Yes, this question is for Nancy or Terry again. Are there efforts to amend collective bargaining agreements in light of the pandemic and its impact on research funding in university budgets? If so, can you comment on those? If not, is there an option?
So all of our bargaining agreements that involve research personnel are system-wide. System-wide, we have been meeting with the unions to discuss the effects of the different leaves that we're offering and other effects of the COVID-19 pandemic. But as it relates to full amendments to the contracts in order to provide some sort of relief to our researchers, that still remains to be seen. We are having active and ongoing discussions with the unions every single week for every new thing that comes out so that we can try and address some of those concerns. But that is something that is top of mind for my colleagues who are having these discussions, and we are doing the best that we can within the confines of the law around these types of things that control our negotiations, et cetera, on those types of issues.
Very good. Thank you so much. Thank you. Okay.
And we have another,
go ahead, Megan.
we have another personnel question. Is a research coordinator assistant, such as someone who works in clinical trials, considered a healthcare worker? Are they eligible for the emergency paid sick leave and emergency FML if they meet the other criteria?
So this is the question. So right now we are working system-wide to get guidance on what is the definition of a healthcare worker and what does it mean for them to not be eligible as it's noted in the chart, because obviously there would have to be some eligibility, but just not the full extent to someone who's not a healthcare worker. So we're still seeking guidance on that. And that's actually, in fact, one of the questions that I have. So we get guidance and then we send more questions and then we get new guidance and we send more questions. So in my next round of questions from Nancy and our human resources organization, that is one of the questions, or that segment is one of the topics that we're sending for additional guidance on.
Where should people be looking to get an update on that, Nancy?
Yeah, so we will continue to update our HR landing page. And then if there's some very notable change, I also alert others on the cabinet, as you know, Sandy, and we have a communication platform through which we connect with folks who are in HR roles across campus. That is a very important question, and we've been pushing, and my colleague Janet Cameron on the health HR side, as you can imagine, has been very attuned to the significance of that question as well. And CHROs across the system have, as Terry indicated, we're very actively engaged with OP and working not only to get information about these decisions, but to influence the outcome of those decisions in a way that represents the important constituents that we serve here at UC San Diego.
Thank you very much. Thank you.
This
Megan?
next question is a personnel related question, but it might be a question for Sandy. How long can we keep postdocs sponsored by federal or industry grants working remotely without being able to meet the actual lab-based experimental project milestones?
Yeah, thank you. I'll start with a framework and then we can add to that through personnel. But there is considerable latitude afforded to the PIs on federally funded grants, if that's how those are funded. And that's either through your individual research project or through training grants to modify the activities for those individuals. So even if someone can't conduct a particular lab-based project, if they can do things that are in the best interest of the overall research program, could be anything from literature reviews, writing manuscripts, preparing presentations, doing data analyses, networking with others in a way that will be useful or fruitful for your future career. Those are all additional types of activities that individuals can be paid on. I will say I have had discussions with leadership in at least 4 federal funding agencies raising these issues for both graduate students projects and for postdocs, whether they're on training grants or whether they're on individual fellowship awards. And in all cases, what I have heard from leadership in the federal, at the senior federal level from these institutes is that they are committed to maintaining the scientific development and workforce development pipeline. So there should be great flexibility on those awards. I don't know, Nancy or Terry, would you like to add to that?
I mean, I think that was a beautiful answer, Sandy. I have nothing to add.
Okay. If there are
Yeah,
specific,
I don't.
Terry.
Oh, I was going to say I don't have anything to add either. I think that really covered it.
So if there are specific questions, please feel free to contact my office. Please feel free to contact the Office of Postdoctoral Scholars as well. And we'll try to work with you on what's the best plan and options as well. Thank you.
The next question is, which office could provide guidance on management of grant funds to optimize use during the crisis?
Well, I think that's a really good question. First and foremost, we would refer you to our web page on Blink that has a whole set of frequently asked questions and answers. Some may be more general, some may be very, very specific. But if you don't see the answer to your question right there, there's a number that you can call that comes in centrally, and then based on the specific question that you have, we will direct you to the best person to answer that question. In some cases, it might be the person who manages your grant in your local setting. In other cases, it may be leadership from the Office of Contracts and Grants or HISPO. And in other cases, it may be Miroslav or me, but we are very happy to try to give you some guidance on that. But very first place, I just go right to the website to look at the frequently asked questions, because these issues about personnel, funding, maintaining your research program and what options you will have going forward to get both extensions in time and financial extensions to help with the continuity of your research program are available there.
Next question. There are employees who believe that what we do in our basic research labs is not one of the activities defined last month by the governor as essential. But Doctors Brenner and Brown have emphasized that we want to allow continuation of as much research as possible while maintaining social distancing. How do you advise addressing this?
I'd say two things. The governor's framework was a very general framework. And what the announcement was quite broad and didn't really articulate all of the detailed kinds of questions that we have had. We've been in conversations with the Office of the President, who has queried about these details and the extent to which we have flexibility as an individual campus to determine what types of things can be conducted here. So we're relying on the Office of the President guidance as they pursue these questions. And we've used a framework here, and I would look forward to Dr. Brenner's comment on this as well. But we've used a framework where we want to maximize the allowable activity that can be done in a safe fashion that's within that framework. But at the same time, never apply undue pressure for any staff member, any student that would be working in the research context, in the on-site research context. And that framework of both maximizing opportunities and maximizing safety is the framework that we use to help guide faculty in this process. If David Zahn, would you like to make any additional comments about that?
That sounds perfect. It's a very delicate balance. I want people to be able to do important research. I want them to be able to complete their PhDs and their postdocs and move on. I want the PIs to be able to complete their research obligations and continue the research programs. But I want everyone to feel very safe. And I think that we have been very rational in finding a sweet spot where we practice social distancing, but we allow people to come and do critical experiments as long as they follow that. So I think we're fulfilling our obligations to society and our obligations to our students and postdocs. So I think this has worked very well. But as I started off my opening statement, it can be abused. And as Sandy pointed out, no one should feel pressure to do anything. Everyone should feel safe. And if someone doesn't want to come to work because they think it's unsafe, we have to take that into consideration and make sure that they're heard. So it's a really good question. Thank you.
Yeah, it's a wonderful question. And I don't know if James Anthony is on, but a couple of weeks ago, he is, of course, the Dean for Graduate Studies. And he and I had a long discussion about the importance of respecting the rights of students in particular, whether they're undergraduate, graduate, or postdoctoral scholars. And just to create the right framework. Anybody, any student, any trainee on a grant is a trainee first. They are our students first, and we want to respect their needs and their rights. They are an employee second. And that's the framework that we're using going forward. So again, no one should feel pressured if there's a concern. Then we are here both in our Office of Research, but also in HR to assist you with appropriate processes there. Great question. It's a tough one.
Sandy, this is Caitlin Schell. If I can just add one comment, please. I will say that the California Life Sciences Association and Biocom and I think OP as well, have been advocating with the governor's office for clarity on on deeming research, especially biomedical science research at this point in time, to be essential. So we still don't have clarification from the governor's office, but just know that those advocacy efforts with the governor's office are occurring.
Good.
Are there any plans to offer antibody testing to UCSD employees or students as part of the School of Public Health's research on COVID-19 at UCSD?
Chip, would you like to begin to address that? And then others may want to chime in.
That's a great question. And these are rapidly moving plates that are getting all this sorted out. Cheryl Anderson has put together an extremely well thought out proposal that she's discussing with the San Diego County Health Department about serving as kind of the last mile between people who are known to be exposed or who have COVID and the county health department in terms of doing contact tracing and epidemic control, using a mix of UC San Diego employees, UC San Diego graduate students, undergraduate students, and really coming to do what Governor Newsom is mandating be done. The last couple of days, he's been talking about having the university system step up and do this. Cheryl had been thinking about this in advance and already has a proposal ready to go. UC San Diego will be part of that community effort because we're part of the community, but we're also talking about a campus-wide surveillance program that would involve both antibody testing and some nucleic acid testing using both the CALM laboratory and some of the research laboratories around the campus as a surveillance tool that will help us both know that we have a safe campus and also provide us some better insights into how the virus is transmitted within the community. David, I think, is still on the call. Are you still here, David, to address it a bit more?
I'm still here. So
Good.
yeah, I want to distinguish between sort of research and clinical care. I think we are really geared up as advanced as any institution I know in the country to do screening, both the for the virus using the PCR assays, including a rapid assay, and for antibody testing, which opened officially yesterday. So that's one thing, and we could talk about whether we should be screening, every patient that comes in, every laboratory person that comes in, and that's one thing for clinical care. Then the other is what Chip raised, which is a bigger issue about whether we should be doing public health research and looking at large populations. And in that case, it would not be done in the CLIA-approved lab. It would be done in the research lab. It would actually be much cheaper. And I think it's a fantastic idea. I think we should start it as soon as possible. Identify, a specific section or a particular, part of the campus or something. Some people suggested, looking at the emergency departments in both Hillcrest and La Jolla and seeing, what both the antibody status is and the viral status is, and doing that as a public health research project, with the public, with epidemiologists directing it and taking advantage of all the platforms and high throughput infrastructure that we have on the campus to direct it toward this. So I think that it's a fantastic idea, and I would like to do a small project just to get our feet wet to show we can do it, and then look to expand it into into covering large parts. And one of the things that Pradeep charged us with is he said, how can we make this campus as safe as possible going forward? And one way I would think would be to have really effective screening, for everyone on the campus.
Very good. Thank you, gentlemen. I appreciate that on this webinar, we spent a bit more time sharing information than we did answering questions. And I will assure you that the next webinar that we have, we're anticipating having one in a couple of weeks, not next week, but probably in a couple of weeks, that it'll be just the reverse. That is, we will share only updates, and then the bulk of the time will go for some of these great questions that you all are posing. In the interim, any questions that you have, please feel free to pose them to us through our website on Blink. I remind you of both of the internal networks that we have, if they are research-specific questions, because there are both resources there to connect with others and opportunities to get important information that might be useful for you for your research. And I want to thank you all for all the efforts that you're making. These are very challenging times. And we are getting ready to gear up for a greater expansion of our research here on campus. But I want to assure you that we will not do that in a way that is not maximally safe for our staff, for our students, and for our colleagues. So I thank you all again for participating today. Great questions, and for all of the administrators that were on, I want to thank you for your participation. Much appreciated. Thank you now. Bye.